Welcome back. We have Dr. Thad Schroeder here from Schroeder Cosmetic and Family Dentistry. We want to talk about dental crowns today, but a lot of that can be caused by fractures in your teeth. And we were mentioning those candy canes. Do you find a lot of fractures this time of year from that?
This time of year is the worst for candy cane fractures. Yeah, if you have a lot of larger, older fillings biting down on these candy canes, oh, we're gonna have to take care of those teeth.
Should you brush your teeth right after you eat something like that, or does it even matter?
Oh, for sure. Get that sugar off of there. Yeah, don't leave that stuff. And I don't care what they tell you. Floss your teeth, okay?
Okay. Because there was a lot of controversy about that flossing didn't really mean anything. I think it was earlier on this year.
Right.
And then dentists came out and went, hello,
are you kidding me? Yeah, that's like not washing your body below your knees. Like, are you kidding me? Clean your teeth.
Are you supposed to do that?
Imagine that.
Is that frowned upon?
You know what you should make? Very good, and we're completely off topic here. You should invent a spray that you spray on your teeth before you eat candy.
I'll work on that next week.
Do you like that?
I know. Get a prototype for our next
week.
Yeah. All right. Let's talk about dental crowns
Back to dental
today.
crowns.
So for maybe, I think we all have a general idea, but just explain what is a dental crown first.
Right. A dental crown is like a cap or a hat for a tooth. Does that make sense?
Yeah.
It goes all the way down to the gum line, all the way around the tooth, 360 degrees. Take a millimeter off the top, millimeter off the sides, all the way around. So that way we can restore the tooth to proper function and aesthetics.
Okay, well, let's talk about for the people who might need a crown.
Right.
Why would you need that?
Yeah, so we see a lot of large, like we were talking about, biting down on candy canes or from a myriad of different reasons, clenching and grinding teeth, large fillings, things like that. We see these fractures in the teeth. As these fractures get larger, you can even talk about doing a root canal or losing the tooth, depending upon
breaking a tooth off.
Yeah, depending upon how far the fracture goes. So with these large fractures, we want to contain it when it's still small, while it's still above the gum line.
Oh, of course.
Exactly.
And there's a couple of options once you decide you need a crown in terms of material. What are the options there?
Plenty of traditional options as well as some more updated and newer options here. Yeah. More traditional being like gold. Gold crowns are the old traditional style and wonderful in terms of function, not the best in terms of aesthetics, at least not for everyone, okay?
Okay.
These are some three images that you have here. You have the gold.
Right.
You have the one that looks like a tooth.
Right.
And is that a silver one? Or?
Right. The one all the way on the right is the porcelain fused to metal. And the problem with those is the porcelain commonly fracts. We know porcelain is extremely brittle. So we see that porcelain fracturing off of the metal and a lot of times can affect the function of the tooth. The more updated materials include things like Bruxeer. You see the solid zirconia there on the left. That's one uniform material all the way through. Looks more natural, can be customized to fit your smile and function.
And that's what you use at your practice?
Yes, of course. We're always talking about always the best, nothing best.
Look, is it more expensive to have that crown that you were talking about that looks like a natural tooth as adverse to the gold or the silver one?
Not necessarily, and every insurance is different. Everything is situational. On the same note, I like to provide wonderful functional restorations.
A lot of conversation. We just brought up this image now because a lot of people don't quite understand the difference between a veneer and a crown.
Right.
Let's talk about that for a moment.
Right, a veneer is exactly that. It's almost like the top surface of a piece of furniture. It's a veneer. It's cemented directly onto the front of the tooth. Now, in terms of aesthetics, what a wonderful result, and minimal preparation of the tooth, minimal reduction of the tooth. So we don't have to change the tooth structure very much. On the same note, it's very difficult to keep those on there and not chip them. That's the problem with veneers.
I've got two.
Yeah, they're a beautiful aesthetic result, but that's the downfall there. You might even have to change your diet a little bit with veneers. With crowns, like I said, go all the way around 360 degrees around the tooth, provide a wonderful aesthetic result, as well as maybe a little bit more function and not having to change your diet. Maybe you can actually still eat those candy canes.
A crown.
It's like asking how long will a car last.
Okay.
You take good care of it, you're brushing, you're flossing, you're staying away from chewing ice on it, it can last you a lifetime.
Is it painful? Because I have a crown and no pain at all when I got it.
Of course, that's the goal, and it always depends on the depth of the fracture and how many old fillings and restorations you've had.
Dr. Thad, again, thank you so much for all your advice.
Of course.
We really appreciate it.
Great to see you guys.
If you want to see all the you want to find out more information, there it all is up on the screen, phone number and website. And, you know, if you have a little bit of emergency over the break.
If you have too many candy canes, go see Dr. Schroeder.
Give him a call. Happy holidays, my friend.
Happy holidays. Great to see you guys.